the UK living with the after effects of a stroke. It's the largest cause of disability in adults. Teenagers, though, are also at risk, with more than 400 people under 18, that's more than one a day, suffering with a stroke each year in the UK. In a moment, I'm going to be talking to stroke survivor Sarah and her mother Joanie, but first, here's their story. Sarah Scott was a healthy and fit 18-year-old. In May 2009, while she was in class at school, she suddenly couldn't speak and fell off her chair. Sarah had suffered from a stroke. She was in rehab for 4 months and couldn't swallow, walk or talk, and her sight was affected. For the next 2 years, her mother Joanie looked after her, and slowly her health improved. But in November 2011, Joanie herself also suffered from a stroke. Luckily, there was no severe damage, and she went on to make a good recovery. Well, Sarah and her mum Joanie are with me now, and we're also joined by Dr. Hilary, who's in Dumfries this morning. You didn't know anything was wrong at all until this actually happened, Sarah. You were fine up until then.
Yeah, fine. Speaking aloud in English class, and I just can't speak, and also a little bit sick,
right?
And also later, like my arm, and my face, droopy.
Yeah, so it got sort of that's so scary, so frightening. What was good, though, was the fact that your fellow pupils actually realised what was wrong, which is extraordinary, because I think in someone so young, it's not the first thing that I would think of. So it was lucky that they were able to actually help you, and you got help really quickly, didn't you?
Yeah.
That otherwise it could have been horrendous.
Yes.
Absolutely horrendous. But what a time you've had, what a tough time, getting back. I mean, you're sitting there, you look fantastic, you really do, talking away, everything's, everything's sort of getting there, but clearly, there's still a bit of a way to go.
Oh, definitely. My speech is so difficult now, and writing and just everything, but I'm slowly getting better, and...
No, it's incredible. And obviously you helped your daughter an awful lot. The two of you, I'm sure you've grown even closer because of this.
Yeah, we were close before, I think, but even closer now. Because when Sarah first had her stroke, her speech was very, very limited. She could only say yes and no, and often got that mixed up. She suffers from something called aphasia, which affects about a third of people who have a stroke. And if that part of your brain is damaged that governs your communication, then it can affect you. And although Sarah looks fine, life is quite difficult in some ways for her, with the reading and writing and,
of course,
and speech.
It's like having to relearn everything all over again. But I know you've got a job. You're working away, which is great. You're working in a supermarket, which is fantastic. And you go horse riding. That's really helped.
Yes, but after my stroke, and it's
not
amazing.
Before.
Oh, no, sorry.
Never before.
But it's helping.
It's really good.
Horses and animals, so that's really good.
It's riding for the disabled.
Oh, it's
fantastic charity, really.
Brilliant charity, and absolutely superb.
Helped Sarah's speech.
Totally, it gives people extraordinary help and progress. They really do progress really well. But you suffered a stroke yourself, isn't that extraordinary?
Yeah, we both had a hole in the heart. It's called a PFO.
Right.
And it can cause the stroke because the blood clot can pass the wrong way through your heart and up to your brain.
Right.
Because there's 2 types of stroke. You can have a bleed or a clot.
Right.
Sarah had a clot, and luckily she got to hospital in that window of a few hours where you can have a clot-busting drug.
Of course.
It could have been much worse.
But again, that was because people realised what was wrong with you. I mean, Hilary's in Dumfries today for us. The signs, Hilary, to look out for, I think it's really important. I mean, that was what was really good about what happened to Sarah. It was awful what happened to her, but actually, that people knew, they realised and got help very quickly.
That's really important, and a good mnemonic to remember is FAST, F-A-S-T. F is for face and facial weakness. So when somebody grimaces, if one eye stays open and the other is closing, or the side of the mouth is drooping and not smiling or smiling crookedly, that suggests that somebody might have had a stroke. So F is the first one. A is the next one, arms. If you have difficulty raising your arms above your head, that might suggest a weakness on one side, a bit of paralysis on one side. The S is for speech. If there's slurred speech, as if someone had suddenly become drunk, slurred speech is an important sign, or absence of speech altogether. And then the T on the FAST is for time. It's really important to act quickly. Dial 999 for emergency help, because 85% of strokes are caused by a blood clot in an artery that supplies the brain tissue. And if you can dissolve that clot in hospital, you get much better recovery and much better rehabilitation afterwards. Sarah would know all about this, but FAST, you've probably seen the TV ads, they're really good.
They are very good, Hilary. Thank you so much, because that's the thing. I think it's really important for you to be here this morning, because I don't think people realise that it can affect somebody so young.
Yes.
You know, it's really, really important. And how is life? Do you feel that every day you're getting better?
Oh, definitely.
Yeah, it's the confidence, I think.
Of course.
But that's coming back.
No, very much so. I think you made remarkable progress. Yeah. You really have, compared to what you were when you first became ill. And I hope you continue to do so. Thank you both very, very much indeed. Thank you. Right, after the break, he is a master of design. I'm going to be talking to Kevin McLeod. And Martin Lewis has been at Trapeze School this week to bring you his real deals, including 2-for-1 theme park tickets. See you in a couple of minutes.